Tonight I am asking, should male health workers be allowed to examine women's breasts? Going head-to-head on this now are Executive Director of the Women's Rights Network, Heather Binning, and cosmetic surgeon Alex Caridis. Thank you very much. Well, I think I'll start with you, Heather, if you don't mind. Should men be examining women's breasts?
Absolutely not, Patrick. Thank you for having me on for this discussion. I agree 100% with what Kemi has to say about it. It is not a nice procedure. Women don't want to have to go through it, but many of us do. There are, we maybe come on to it, some women that don't come forward for it. And I wonder what the problem is that they're actually trying to fix. That we know there aren't enough female mammographers, but why is that? What research has been done? What's the data to say, you know, are the terms and conditions, can they be approved? Is there something wrong with the training? I would put my efforts into getting more women to come forward and take a role as mammographer than to fill that gap with men. Use the men to fill the gaps that are left behind by women changing tack and going into mammography.
It does feel as though we've taken one step forward with the Supreme Court ruling when it comes to women's safety, and then maybe a giant leap back by having, you know, fully fledged blokes examining women's intimate parts. But Alex, I'll bring you in on this. I hope you don't mind me asking a personal question, but I think it's relevant. Would you be happy going to the doctors for a check on your intimate area and that being done by a woman?
Yes, personally, I wouldn't have a problem at all with that, because at the end of the day, people are professionals, okay, and they've been trained to do a particular job. Now, the thing is this: you said examine. You know, I mean, radiographers are not sort of medically qualified to examine people. They basically are trained to do a procedure. And in the breast screening, they're there to help sort of place the breast on between two screens, which are gradually compressed, and therefore you get a mammogram out of that. Now, obviously, that's slightly simplified, but it's not like the same as you go to a breast surgeon who examines your breast thoroughly and properly. So I think we shouldn't really sort of confuse the two issues here.
So, Alex, can I just ask you a question? Before I go back to Heather, do you think it's basically all right as long as women have a chaperone? Is that right?
Listen, I completely understand the sensitivities with some women, and for some women, you know, they feel, you know, they would rather have a female, either doctor or practitioner or radiographer for that matter, and I appreciate that and I understand that. However, I don't think we should automatically say that no, you know, they should be all women or no men at all, because I think they've been trained properly. They abide by the normal code of ethics, etc.
OK, well, Heather, I'll let you just come back to that then. What do you make of what Alex has said? And would you be in favour of it if there was a chaperone present?
No. To be quite honest, no. But also having chaperones is increasing the number of staff that would need to be had. And there's two elements. There's a chaperone for the women and for her safety and privacy and dignity. Presumably that chaperone would be a woman, so there's another woman being employed there. But also, surely a male doctor or male employee carrying out this, a mammographer, were there such a thing, would also, if his employer was to be looking after his rights, surely they'd want a chaperone there for his protection and safety from any future complaints that may be made about him. It is a very invasive. I mean, I don't want to. It is, your breast is put between two pieces of glass and squeezed together. It's unimaginable what that can. It's painful for a lot of women. There's a very small minority of women for whom that is not very painful and uncomfortable. And you're standing there completely topless, and the dignity is out the window. So really, to have a woman there is fine. I think if you're being treated for something, if you're going to a doctor, to have that, if you know that there is a problem and it needs to be investigated, I think that's a different kettle of fish. But this is screening. We're trying to get women to attend these screenings. It's vitally important. And I know women that would not have attended had it been had been a male. At the moment, there are, I think, less than 50% of women attend their first breast screening. There are a third of women that do not attend any further breast screening. So there's a big problem there. Were you to introduce the fact that this is not a female service for females, then I think that's where you would see the knock-on effect, and those numbers would drop even more drastically.
Yes, and I do think as well, doing the kind of classic thing, obviously making this all about me. I think that if I, wanted to be examined in an intimate area and I knew that a woman was doing it, I would probably be less inclined to go and do it. That's just a personal thing, I think. But Alex, I mean, do you think there's maybe an avenue here for predators? You could go into any single aspect of medicine. If you, as a straight man, decide to go into something that basically means that all day long you're looking at women's breasts, is that not maybe a massive red flag?
Well, then, I'm sorry. Then that applies to every breast surgeon, because that's all they do all day long. Many of them are males. That you can't classify all male breast surgeons as being predators, for heaven's sake. I mean, I think that's a bit ludicrous.
Okay. Do you not think that there's a chance that there's a disproportionate number of them that might be because they've chosen to go into that line of work?
There's always a chance to have a bad apple in every walk of life, isn't there, unfortunately? But you can't generalize like that. That's totally unfair.
Okay, no, fair enough. Heather, what about, and I'm just going to ask this now, okay? I'm not saying I agree with this view, but it's something we were talking about around the office earlier. What about if the man was gay? So there's absolutely no sexual thing whatsoever when it comes to that particular part of the female anatomy. Would that change things for you?
No, a male is male, regardless of their sexual orientation. A male is a male, and it's as straightforward as that. And I'd like to pick up on a couple of years ago, we did a report on when we are at our most vulnerable, and it was about rapes and sexual assaults in hospitals, in hospital settings. And there was 6,500 rapes and sexual assaults over a 3.5-year period. That was including COVID. And about a third of that number were rapes. Now, I'm not saying that every medic is a sexual predator, but there are sexual predators that are in there. And what worried me about the statement that came out from the Society of Radiologists was this, it's a very enjoyable, desirable and enjoyable career. And men are saying, we would like to access that same career. And so my ask is, who are these men? And what question were they answering? And why aren't women asked as well? What is the question should be, why are more women not coming forward to this role? Not how can we fill this gap with men, and women's privacy, safety and dignity out the window, as you pointed out earlier, Patrick, once again.
I suppose, Alex, now I'll come to you on this. I suppose the argument, well, in fact, the argument is that we've got a massive backlog here, and that maybe some women would rather that they were just seen by someone, and so this could be a solution to that.
Well, yes, I mean, I do agree, because at the end of the day, there is a problem in the NHS with staffing, and if there are male radiographers who can do the job, and if we have a shortage of female radiographers, then so I don't see anything wrong with that. I mean, sure, it's about choice, and women can have the choice. If they'd rather have a female radiographer, they can actually mention it, in the same way that when I have a patient, we always ask them if they like a chaperone present. As I said, as I think my person, sorry, yes, she mentioned that for our own protection as well. But yeah, I mean, we have absolutely no problem with that. So okay. I think we have to be able to respect people's choices as well. But I don't think we should blanket cover and say there shouldn't be any males.
All right. I mean, again, I just can't help but look at this and think, if we've got a shortage in a specific area, why is the solution to that to do something that some people might regard as being radical, instead of going, right, why don't we just train more women to do this and maybe incentivise them to it, wipe away a student loan?
Well, because it takes time. It takes time to train people. We already have ready male radiographers who are perfectly able to do the job.
Fair enough. OK, look, both of you, thank you very much. It's great to chat to you. That is the Executive Director of the Women's Rights Network, Heather Binning, and cosmetic surgeon Alex Karidis. So there we go.